There are only a few items necessary to perform the SphenoCath, and so I've put them out here for your viewing. What we start with is the lidocaine jelly. This is applied to the end of the catheter tip to help with the insertion of the catheter into the nares, and also gives a little bit of local anesthetic when you're about to inject the medication. We use a combination of 2% lidocaine here for most of our patients, usually about 1.5 cc per side. The SphenoCath, as you can see, comes packaged in this kit. It has this temperature strip. The importance of the temperature strip is it's one of your true indicators of a good block. And what I mean by that is you'll put this just on the side of the cheek here, and when you do a ganglion block, you should have a temperature elevation of a few degrees, and you should be able to see that almost immediately. So that's one of your indicators that you've had a successful block. So the first step to doing this procedure is applying the temperature strips. And what I usually do is kind of go from the corner of the jaw, kind of the TMJ, towards the base of the nose, kind of that maxillary region that we call the V2 distribution. And then we'll be able to monitor her temperature increase when we do the procedure in just a second. Then I take the catheter and make sure that, first of all, that it seems to be moving smoothly, because I don't want to get into the patient's nose and have a little bit of a catch or a snag and make it uncomfortable for the patient. So I separate the two, the purple from the gray, so that we have a nice, direct, straight catheter with none of the purple catheter coming out. I attach the 2% lidocaine to the catheter, and you'll notice there's an arrow here. I like to use the arrow to angle just a little bit towards the nasal septum, and usually that walks me right down to the posterior nasal bone that I need to use as my backstop before I engage the catheter. And I come in here, I try to go right down the middle nares so that's comfortable for the patient, advance the arrow down towards the septum, and then you'll see right about here, I come to a stop point. See that? That's when I engage the catheter by pulling it back, inject half the medicine, and then re-engage and remove. So again, the other side, go into the middle nares, angle the arrow towards the septum, advance the catheter gently, very slowly, till you hit the posterior septum. That's your backstop. Pull the gray to the purple, inject the medicine, separate, and remove. And that's how simple the procedure is. And now you'll notice that as we look at her eyes, she's starting to tear up some, and you can start to see some of the little red blood vessels popping out in her eye that weren't there previously. And then if you'll look at her temperature, you can see there's starting to be a change from, it looks like it's from about 88 degrees to about 90. And so, again, my 3 indicators of a good block are the temperature elevation change, and that's important, and that's part of your documentation, of course, and then the tearing of the eye and the redness in the eye. And then really your best indicator is a few minutes later checking with the patient to make sure that they've had complete resolution of their symptoms.